Peritoneal dialysis. It is a way to remove waste products from your blood when your kidneys can no longer do the job adequately. A cleansing fluid flows through a tube or catheter into part of your abdomen and filters waste products from your blood. After a prescribed period of time, the fluid with filtered waste products flows out of your abdomen and is discarded. It differs from hemodialysis, a more commonly used blood filtering procedure. With peritoneal dialysis, you can give yourself treatments at home, at work, or while traveling. It is not an option for everyone with kidney failure. You need manual dexterity and the ability to care for yourself at home or with the help of a reliable caregiver. There are different types of peritoneal dialysis: the intermittent, continuous ambulatory, continuous cyclic, nocturnal intermittent, tidal volume, and continuous flow peritoneal dialysis. We'll be focusing on continuous ambulatory peritoneal dialysis with the use of the Tenkov catheter. It is a permanent tube that needs to be placed in the lower part of your belly. This is used to run in and drain out dialysis fluid. This soft, flexible tube lies flat against your body. There is no opening and no odor. It is the most widely used throughout the world. It is made from silicone rubber tubing with a radio-opaque stripe. They have a 4.9 mm or 5.0 mm external diameter and 2.6 mm internal diameter. It has one or two Dacron polyester cups. It is either straight or coiled intraperitoneal segment. It is sometimes called or referred to as curled or spiral catheters. The coiled intraperitoneal segment offers several advantages. Infusion pain is less frequent because with the coiled design, more of the solution flows through the side holes, and the flow through the main lumen is within the coil and not aimed directly toward the peritoneum. Also, there is not the poking effect sometimes experienced from the tip of a straight catheter. Coiled catheters have a lower incidence of outflow failure than straight catheters, as they are not as likely to migrate, and in one study had significantly higher survival than the straight Tenkov catheters. What happens on the day of the operation? If it is in the morning, you will not have anything to eat or drink after midnight. If it's in the afternoon, you will be given an early breakfast and then nothing to eat or drink after that. If you have diabetes that is treated with medication, it is essential that you inform the nurses of this. You will be given an antiseptic solution to shower with, and excessive hair must be removed with electric clippers. Preoperatively, prophylactic antibiotics are given an hour prior and 6 to 12 hours post-op. Use of laxatives and urinary catheterization if needed to make sure bowel and bladder are not distended at the time of surgery. What happens after the operation? When you have recovered from the anesthetic, you will be given painkillers if you need them. You will be encouraged to eat and drink as soon as you feel like it. You will have blood tests to check your kidney function and hemoglobin level. Your tube will be flushed with dialysis fluid to make sure that it is working properly. It will then be capped and not used for 2 weeks so that the wound can heal completely. Very occasionally, the blood tests may indicate that you need to start dialysis before the 2 weeks is up. This will be done using either hemodialysis via a temporary neckline or using the automated peritoneal dialysis machine, as dialysis can be performed using smaller amounts of fluid, which is safer in the immediate post-op period. If this is required, you may have to stay in the hospital a little longer. There will be 2 dressings on your abdomen, and you will have a stitch in place closing the exit site. What immediate follow-up care will I receive? Before you go home, you will be seen by a member of the team, appointments for your dressings to be changed, and for blood tests to be taken 1 to 2 weeks after operation. The dates for your dialysis training will also be organized. You will be given a list of instructions for how to keep the tube safe when you get home and keep your dressings dry. No showering or bathing for 2 weeks. You will be shown how to renew your dressings yourself during your training. No driving or lifting for at least 7 days. Take laxatives regularly if necessary. It is important to have a good bowel movement daily, as constipation can interfere with the working of the Tenkov catheter. You are usually able to go home the day after the operation, and before you go, you will be given phone numbers to ring should you have any problems. What complications might occur? There are four main possible complications that could occur with this procedure. Occasionally, the catheter may not work despite apparently successful insertion. This may be due to the tip of the catheter sitting in the wrong place or getting covered by internal tissue which stops it from working. Bleeding may occur mostly as a result of bruising around the wound, and it usually stops at its own accord, or in rare cases you may need to have more surgery to stop the bleeding. You will be given intravenous antibiotics at the time of the catheter insertion to prevent infection. Despite this, some patients develop infection at the catheter exit site, which requires treatment with a further course of antibiotics. Very occasionally, this may require the catheter to be removed. There is also a risk of infection developing deeper in the abdomen, causing peritonitis in the immediate post-op period, which is the first 2 weeks after insertion. Bowel perforation. It happens very occasionally during the course of the procedure that the bowel is cut by mistake. This is a serious complication that may require a surgical operation and an inpatient stay in the hospital. Long-term exit site care. Restrict post-operative dressing changes to trained staff. Frequent dressing changes during the first 2 to 3 weeks are not necessary unless dressings are wet. Weekly dressing changes are recommended. Routine care must be done frequently. A good hand washing technique is important. Aseptic technique using masks, gloves, and sterile supplies is required. Assessing of the site before cleaning. Using a mild non-irritating agent to clean the exit and surrounding site. Strong disinfectants should be discouraged. Sterile water, normal saline, or chlorinated water should be used to rinse the exit site and should be dried. Mupirocin calcium or another antibiotic may be applied for prophylaxis, and an absorbent sterile dressing should be placed over the site. Semi-permeable dressing should not be used alone as they trap moisture at the exit site and have been associated with increased incidence of infections. Catheter must be immobilized. The progression of healing should be evaluated and documented at each dressing change by staff. And lastly, patient education. It is the key nursing role. Nurses are morally obligated to provide teaching that will enable patients to acquire the knowledge and skill they need to follow their medical regimen, prevent errors that could endanger their safety, and promote their health and well-being. A lot of the factors can affect learning, and it is important to find out these barriers.